September Tobacco Free Tuesdays webinar. Thank you for joining us. This is going to be a topic that I hope you enjoy. You're going to see the regional coordinators up front and center this morning, and I hope get to know a little bit more about each of us too, and how we can help you in your communities really tackle this very important topic around vaping. And as we start every webinar, we want to put up a poll just to find out how much you already know about the topic or don't know about the topic. So our question this morning is, what are the most common reasons youth vape? Just choose one, please. Either used by a friend or family member, the availability of flavors such as mint, candy, fruit, or chocolate, stress relief, belief that they are less harmful than other forms of tobacco such as cigarette, easy to steal, hide, or conceal, or they see them on social media, TV, movies, or in video games. So take a couple seconds and choose what you believe is the most common reason you vape. And I know everyone on the call has tackled this issue, and that's why we probably will have a lot of people on this call. It's probably the one thing that we hear more and get requests for more than any other topic is vaping and e-cigarettes. So let's see the answer. What are the most common reasons youth vape? Used by a friend or family member, you said 44%. And then the next one, availability of flavors or belief that they're less harmful. So the top two reason, 33% for both, is used by a friend or family member, and then the availability of flavors such as mint, candy, fruit, and chocolate are the top two reasons that people use vapes. And the other one, Sarah, correct me if I'm wrong, but it's the belief that they're less harmful. Is that correct? For the third choice. At 19%, yes. We all know that all of these things impact why our young people are using vapes. The numbers are continuing to increase. You'll hear more about the data in a little bit, but it's a problem that are in our schools or in our homes or in our youth organizations. And I think we as a community really need to tackle the issue head on and provide resources. So that's why you will see the friendly faces in front of you now, and we're all going to stay on camera this morning because we really want to introduce you a little bit more closely to our regional coordinator, the Virginia Tobacco Control Program regional coordinator team. And I am Gina Roberts. I am a regional coordinator based out of the southwest part of Virginia. I live in Gladys, Virginia, which is a very small town about 30 minutes south of Lynchburg. I live with my husband, my two daughters, and Harley, my golden retriever. And if anyone knows me, then we'll share just a little personal tidbit. Most people already know this, but Chick-fil-A is my favorite spot. So if you find me out of work, it will probably be at a Chick-fil-A. So I just wanted to share that. Mark, our program manager, our new program manager, has found that out very quickly as he started working with me. We also have Sarah Burkhead. She's the Central Regional Coordinator. She lives in Chesterfield County with her husband, son, and her Italian water dog, Maggie. She loves paddleboarding on the James River, hiking in the mountain, and watching sunrises in the Outer Banks. And if you know Sarah, I think anything that you do outside, she loves. She just loves spending time outside. Then we have Nicole Mann, our Eastern Regional Coordinator. Nicole lives in Virginia Beach with her, get this, 100 plus tropical houseplants. She loves houseplants, and she is even in a houseplant club where she shares resources and plants, and she is our plant expert. Nicole also loves traveling with her friends and eating good food while on vacation. If you need to know where a good restaurant is, contact Nicole, she'll know. Then we have Tiffany Eustace, our Northwest Regional Coordinator. She is originally from Minnesota. She lives in Goochland with her husband and two boys. She was a health coach for 14 years, and she also loves being outside as much as possible. And Tiffany, although the newest member of our team, has just been an amazing asset in really getting out into the community. So many of you on the call have probably already met Tiffany. So we are your fearless regional coordinator team. We're here to be a resource, and we hope this presentation on vaping in Virginia with data, with resources, with why we are tackling this issue, and then a cessation program that we actually have as well will benefit you. So after this presentation, I really want to again come back to really hone in on the fact we are your resource, right? As we begin this program, the programs in the communities, please call on us to help you. So I'm going to turn it over to Sarah as she starts the presentation. And please don't forget to put your questions in the Q&A box.
Thank you, Gina. And hello, everyone. Good morning. We're so excited to see so many of you on this webinar. This is something we've heard so much from our schools, from our coalition members, from parents out in the community. What can we do about youth vaping? So we decided to use our September webinar as a back to school guide around vaping to offer those tools that you all can use to help prevent and reduce youth vaping and tobacco use. We know there's not just one thing. It's not a simple solution, but there are a lot of things that you can do. You all are experts in your communities. So we hope that today you'll get some new ideas and some resources that you can take back to your community to really tackle youth vaping. So why do we care, right? In 1975, smoking among 12th graders was at 37%. In the year 2000, youth smoking cigarettes was down to 23%, but still really high. And then in 2022, smoking was at an all-time low among our young people. You can see here at the National Youth Tobacco Survey that smoking was at 2%. But e-cigarettes are consistently the #1 product that young people are using, tobacco product. And so we want to remind everyone today that nicotine in any form is a concern. Nicotine can harm the growing adolescent brain that's continuing to grow till about age 25. Using nicotine in adolescence can harm the parts of the brain that control attention, learning, mood, and impulse control. And using nicotine in adolescence may also increase risk for future addiction to other drugs. And I want to remind everyone too that this is not, even the word vapor sounds like, something coming off of a tea kettle, the water vapor, but it's really an aerosol. It's more like hairspray, like an aerosol. And we've seen lung inflammation and some health risks using these products, but we still do not know the long-term effects of breathing in chemicals. That's what you're breathing in. Gina mentioned that flavors are a big reason youth use. You're not eating a mango, right? You're breathing in an aerosol that is designed to taste like a flavor, like mango or blue raspberry. Next slide, please. And these products didn't just appear out of nowhere. Youth didn't find them on the ground and start using them. We know that these were targeted specifically to young people. So tobacco companies were told they could not market to youth, but vapes and e-cigarettes kind of went under the radar when tobacco companies were starting to market these, especially Juul, as you all know, where they also were using nicotine salt products. So these were products that were higher in nicotine and very strong nicotine products, but also being marketed and made to look very cool and hip. And one of the main reasons that we care also about vaping right now is the connection that we're seeing around vaping and mental health. We know that when anyone uses nicotine, it releases dopamine. It actually feels good in the short term. But in the long term, with those cravings, and as your body wants more of the nicotine, it can cause more stress in your body until you relieve it with nicotine. That's the basis of that nicotine addiction. Nicotine itself is a very strong addiction. And so what we're seeing in the research is that nicotine can worsen symptoms of anxiety and can amplify feelings of depression. So I know mental health is a really strong concern for all of us. I'm sure you all have seen the data around the mental health issues of our young people. And so when you're using these products, these high nicotine salt products especially, it can really make mental health worse. But the positive is that the Truth Initiative did a survey where 90% of young people who quit vaping, they felt better. They felt less stressed, less anxious, and less depressed. So there is hope, but this needs to be a part of our conversation with young people. So the question we get is, what can we do? What can we do? And so today, what we're going to cover for you all, we're going to very briefly go over some of the trends, the data. Nicole, could I have the next slide, please? The trends and the products that we're seeing young people use. We're going to talk about some tips for nicotine and tobacco prevention. We're going to talk about tobacco-free school grounds and those school policies. And then we're going to cover several programs for schools and after-school programs. And then we'll end with some cessation tips for our young people. Now, hopefully you all watched our Tobacco Free Tuesday, where we talked about data just a couple of months ago. And Michael Parsons from the Virginia Foundation for Healthy Youth went over some of this data, but I just want to share one of his slides to start, which is the Virginia Youth Survey in 2021. Go back just one, thank you. Where we did see vaping rates come down. So we saw them come down to 14.3%. Cigarettes, as we've already mentioned, are very low. They were down to 2.8%. And the next Virginia Youth Survey will actually be administered this fall. So we're curious to see. A lot of the young people that took it went from a paper survey to an electronic survey. And so I'm curious to see what the data will show us in 2023. Next slide, please. And so this Brian King from FDA presented just this past week. And this is the National Youth Tobacco Survey. So nationwide, we also saw a dip for e-cigarette rates. And again, the reason I mentioned the Virginia Youth Survey data was collected differently. So was the National Youth Tobacco Survey. So that's why you see dotted lines and you see it broken out in 3 sections. COVID pivoted a lot of the way that surveys were administered. And so they tell us you can't compare apples to apples with these surveys, but it still gives us a glimpse, right, of these trends and this data. So you can see really in 2019, vaping was very high. And then in 2022, it is down to 9.4% for e-cigarettes. Next slide, please. But when you dive deeper with this National Youth Tobacco Survey, I do want to bring a couple of things that are still really, that bubble up as concerns. And one of these is for those youth, even though that number went down, for the youth that are currently using e-cigarettes, they showed strong signs of nicotine dependence. So what that means is that they had high rates of daily use and frequent use. So the number is down, but we're seeing them using often. And then when you break down by subpopulations, you can see that the rates for lesbian, gay, and bisexual students were almost double that of heterosexual students. For transgender students, the rate of use was very high at 18.9%. And for students reporting severe psychological distress, again, that rate was very high. It goes back to that mental health slide that I showed as well. And when it comes to what products, you can see it's all across the board, right? So I feel like in public health, we're always playing catch up, where we're at a coalition meeting and someone says, have you heard about this product? This is what we're starting to see. When Juul had to stop their with the flavor ban, they were no longer allowed to sell flavors. We all of a sudden saw spikes in puff bars. But I first heard that from a school that said, what are these disposable vapes that I'm finding in the parking lot? And that was a puff bar. Elf Bar has become extremely popular. And you can see in that, well, it's hard to see, but in the far right, that tiny little green dot, that's Elf Bar that wasn't even on the scene last year. And so our surveys that are asking about these products, that are putting in names of products, it's hard to keep up with what we're asking young people with what they're using. But overall, we see youth using disposable vapes with nicotine salts. I'm going to turn this back over to Nicole to talk about prevention.
Great. Thank you, Sarah, for that great data, great background. So I'll be focusing on prevention in this section. All right, so we have our tobacco control toolbox, and within this, we have community interventions that help prevent and reduce tobacco use. So the three that are circled are, what is shown to really reduce youth use, and this includes tobacco price increases, smoke-free policies, and also cessation access as well. So in the bottom part, you'll also see age of sale. So, as a reminder, nationwide in 2019, we had T21, Tobacco 21. So, the legal age to sell tobacco products rose from 18 to 21 years old. So, this includes all tobacco products, including e cigarettes. There's no military exemption as well. And, we also know that young people also get tobacco products from, older friends and family, but also from stores as well. And T21 is important because it delays that, the longer youth delay substance use, the less likely they are to become addicted. And also, raising this age, youth are more likely to hang or less likely to be around people who are 21 or older compared to those 18 and are, still in high school with them. So it really increases that age gap. So here we have, also in 2019, the same year, we were able to pass a bill that became a law that implemented all primary and secondary public schools have to have a tobacco-free policy, and this includes all tobacco products, including e-cigarettes. It applies to everyone who comes to the school, so students, staff, faculty, and also visitors, and also applies to off-campus events. So if they have prom or, off-campus at a hotel or a debate or a sports event, those events also have to be tobacco-free. And I have some pictures here. You'll see me in the bottom middle talking with Governor Northam right after he signed the bill. So it was a great experience that the team, was able to witness. All right, and here are some two policy initiatives. So to continue, the prevention of secondhand smoke and also to have clean, healthy outdoor spaces, we have Share the Air, led by Virginia Foundation for Healthy Youth, VFHY. And if you watch our May Tobacco Free Tuesday, which is online, you can hear more information from the Y Street, the youth who really focus on this, and some more information on tobacco-free parks as well. And to continue on from my last slide, tobacco free from K through 12 to continue on to higher education, we have Eliminate Tobacco Use program. So we work with the committee there. It's really led by VCU and UVA, and just trying to, continue that tobacco free policy from K through 12 again to higher education. And here we have some tips on how to talk to youth about vaping. This is really for adults. So whether you're a parent, a guardian, a teacher, a school nurse, a sports coach. So just some tips. So I'm going to break it down to 3 parts: before, during, and after. So before, you want to be prepared. So know your facts, do your research. Show empathy, go into this with an open mind, a calm approach, and also find the right time and place to bring this up. So maybe you're walking or you're out and about and you see someone vaping and your teen says something about it, start opening that conversation, and really, have it non-confrontational, because you want to really focus on their health. So know that you're both on the same side when it comes to big tobacco, when it comes to these products. You're really concerned about their health and their safety. Again, have this be an open conversation. You want to actively listen to the youth because they may know more than what you think. Don't have this be a lecture. And also, again, share the facts. So many things are exaggerated. Really focus on the research and the truth. That's what youth really want to know. And again, be open and honest. So be ready to hear, your child may have vaped before, be ready to hear that, and also provide the resources that they need to get them the help, which we'll go further into later on today. And also be a role model. If you have used tobacco products or nicotine products, it's okay to share that. And also, we know that quitting is very difficult. So you can share that journey. May have taken you multiple attempts to quit, and maybe they're going through that as well. So having that open conversation, that dialogue definitely helps. And after, again, thank them for listening. and, being honest and, trusting you to have this conversation, and also continuing to make the right decisions for, again, their health and safety. During your research, when you're preparing for this, you might have seen that, stress and peer pressure are big motivators for teens to vape. So be prepared to help them manage those aspects of their life as well, and continue this conversation. It's not just a one and done conversation. Bring it up, because there's always going to be more questions, more nicotine products, as we saw in one of Sarah's slides previously. The Elf bar is something new. So there's always something else coming up, and there's more research. So, keep up with those facts, and, be willing to talk about that with your youth as well. And we have some more information. These tips really came from Live Vape Free's discussion guide, other discussion guides from American Lung, SAMHSA, and the Surgeon General's tips. And we'll kind of go more into other resources as well later on. So here next we have tobacco-free schools. I'll pass it back to Sarah.
Thanks, Nicole. And I just want to say, someone asked in the Q&A if these slides will be available. And yes, we will send a link to this recording and the slides, which will have active links, so you can get all these resources and see what works for your community. So as Nicole mentioned, all of the public schools, K through 12 in Virginia, are comprehensive tobacco-free, which is really great. If you know of an independent school that may want to look at their policy, please connect us, your tobacco control team. We would really, that's part of the technical assistance that we provide. And so we'd like to look at those policies and help strengthen them, and to see what issues they're having that a policy may be able to help. And so these policies are prevention, and they are cessation tools in and of themselves. So the next slide would be great, Nicole. Thank you. So the Virginia Foundation for Healthy Youth, they were the leads in those school policies before it became a state law. They worked one-on-one with school systems to adopt their 24/7 campaign. Many of you probably are a part of school systems where you had a 24/7 campaign at your school. And I just want to remind everyone that these resources still exist. Even though all the schools K through 12 became tobacco-free, this website still has incredible resources that I reference all the time when working with schools. So from this site, you can find a model policy, language for games or school announcements, how to let people even know that you have a tobacco-free policy at your school. It has a fantastic definition of what is a tobacco product. We know the language is a little bit hard, right? When you say vaping is that a tobacco product? And so it is from the FDA. We follow the FDA definition, but someone who just thinks about a Juul may not think of it as a tobacco product. So it's a great definition to have in your policy. There's tips on how to talk to visitors that are visiting, maybe that are at that football game. And then there's responses to challenging questions and enforcement tips. So I just want to mention, I work at a tobacco-free site. My home base is Richmond City Health District, and that is a tobacco-free campus. And so if someone is coming onto our parking lot property, I model as the tobacco control program coordinator, but I say to someone, hey, you may not know this. However, this is a comprehensive tobacco-free policy. For the health of all who are visiting our health department. That means no tobacco products are allowed. And typically, I've never had anyone question it. They just say, okay, thank you, I didn't know. And they walk off the campus, or they put out their cigarette. And so some of those tips you can find here too. It may not always go that smoothly, but when you're educated and you read up about it, you feel more comfortable to have those conversations. The American Heart Association also has a fantastic toolkit called Tobacco Free Schools Toolkit, and it has information on updating your policies and whether the policy is designed to effectively prevent nicotine addiction. They have education strategies, considering student-to-student education programs or parent education strategies. And then they really focus on supporting students. So we know half of students who vape want to quit. So supporting students is a more effective response than punishing with a suspension. I've already mentioned nicotine is a really strong addiction. So how do we support students in quitting? And then for those of you who are looking at an alternative to suspension, If you're changing your policy where that first offense is supportive with cessation resources, this toolkit is really great on making the case for that. So it comes from the Public Health Law Center at Mitchell Hamline School of Law, and really goes into depth about why they recommend alternative to suspension measures for tobacco use. And it may also help to do an environmental scan. Maybe you even have a student group at your school that wants to do this, or your local coalition that can, starting from entering that school grounds, are there tobacco-free signs for some of your school systems that signed up or were early adapters of the 24/7 campaign? Are those signs kind of faded? Are they visible? Are there enough of them? So just having the sign is an enforcement tactic. And so check that out, see how they look. The sign on the left is from the Virginia Foundation for Healthy Youth. That image can be sent to you if you needed to print more signs. Again, we've already talked about this briefly, but are you making announcements at football games, debate tournaments, back to school nights, reminding everyone that the campus is comprehensive tobacco free? Do you see tobacco or vaping products on the ground, and where? That might be an opportunity to talk to students. Young people are really concerned about the environment. So talking to them about how vapes are trash and hazardous waste. So even having that conversation may change the way they're thinking about what they're putting in their own bodies. And that also could show a hot spot, or maybe a place where a sign would be helpful, or if you have staff that kind of monitor the school grounds, that might be an area that they would want to look at as well. And then, are your staff trained? Are they comfortable to ask other staff, visitors, or students to not use any tobacco product? And so that's something you can work into an orientation for new staff members at a school. You can work in these tips for maybe a staff in service, even doing role plays, making sure that every staff member knows your policy and knows what you're doing if a youth is found to have a vape product on them, or any tobacco product. And if you're thinking about other programs, we've heard of several school systems that have recently put in vape detectors. And I did just want to mention that according to CDC, the vape detectors in school bathrooms lack evidence. So that doesn't mean they're necessarily not helpful. They just haven't been shown to have enough evidence to be on a best practice list. If you do have them, perhaps consider what supportive programs you're giving the youth that are found with these vapes when the vape detectors go off. So again, that's using the cessation resources, reminding the student that nicotine is a strong addiction. One of the main reasons they may need to use throughout the day is because they are addicted to that substance. But I'll tell you, teens do not see themselves as addicted, but there's a reason they keep coming back and using those products throughout the day or throughout the week. So I just have an article there from Wired, but how wily teens outwit bathroom vape detectors. So we know the detector goes off, but it still takes a while, right, for a staff member to get there. And the reason vaping took off in the first place is that these products are easy to conceal. They're little, they're easy to hide. The vapor may dissolve by the time someone gets there. And so really thinking through how your staff will respond to these vape detectors, and whether you have supportive services along with that response. We've also heard of a lot of anonymous take-back events. And so I don't expect you to read this, but these are just clips on how DEA does not have standardized ways to recycle e-cigarettes. We know that sometimes with these take-back events, the batteries, when they are side by side, that can create a risk of a fire hazard. And again, e-cigarettes are considered hazardous waste. And so anonymous take-back events, it just gets a little confusing with how that can really help a student. Or are they just trying to get rid of their device so they don't have to take it home and figure out where they're going to get rid of it, or so they're not throwing it in the parking lots? We hear there are a lot of vapes in the parking lots. But really, what is that take back event doing? And are you offering supportive services and resources for someone who's addicted if they are going to turn in a device? And then we also want to make sure that you're looking at the funding source and the level of evidence of any prevention or cessation program that you're considering. So you probably remember in the news that Juul spent hundreds of thousands of dollars funding a youth program. And so that raises a flag, right? That raises some concern when an e-cigarette company is going into schools to talk about education and prevention. So we want to make sure this is part of the Juul settlement, right? So you want to make sure that you're looking at the funding source of these programs, including the ones that we'll share today from our national partners, and that you're really looking at the level of evidence that has been shown with these programs so that we really can pick ones that will hopefully help the young people in your school system. Now I'll turn it over to Tiffany.
Thanks, Sarah. Okay, so we've heard about trends and products and tobacco-free school resources, and I'll be talking about prevention, cessation, and alternative to suspension resources for schools. So we don't endorse these programs, but we want you to have a variety of tools to support your schools or community's needs. And throughout these 9 programs that I'll be going over, I'm just going to give a brief overview, and all the links to these programs will be sent out in the follow-up. Okay. So to get started, Vaping, Know the Truth, it's a prevention and cessation. It's a free digital learning experience, part of Truth Initiative's nationally recognized Truth campaign, made available to schools by leading social impact education innovator Everfeed. So in addition to encouraging students to live vape-free lives, this self-led interactive curriculum offers resources to help young people who are currently using e-cigarettes to quit Truth's first of its kind text message youth quit vaping program called This Is Quitting. And this is for grades 8 through 12. It's 4 30 to 40 minute lessons that are self-led. And this is free. So what sticks out for this program is that it is being used by about 45% of schools across Virginia. And then This Is Quitting has already helped over 600,000 youth and young adults on their journeys to quit. All right, so the next one, the Stanford Tobacco Prevention Toolkit. So another prevention one. Theory-based and evidence-informed resources created by educators, parents, and researchers aimed at preventing student use of tobacco and nicotine. So every lesson provides activities, online quiz games, and worksheets in addition to presentation, resources, and other materials aimed at addressing key factors associated with youth e-cigarette use. So recommended grades, elementary, middle, and high school. The time is 6 lessons, 50 minutes each, self-led. And what's kind of special about this one is that it also has elementary. So they have 2 lessons, 50 minutes each. And then one other thing that kind of sticks out about this program is I have one school in the northwestern region that has been using this, and they've been getting positive feedback from the students. All right, next one. So another prevention, Aspire MD Anderson Cancer Center. This is a free online prevention education resource from the University of Texas MD Anderson Cancer Center. This delivers tobacco prevention education to teens and adolescents, and again, at a self-directed pace. The students travel through interactive modules, complete quizzes. They can hear from testimonials from former smokers, healthcare professionals, and cancer survivors. The curriculum is available in English and Spanish, so that's kind of what sticks out about this one. And it also aligns with both national education standards and Texas essential knowledge and skills. So for middle and high school, English and Spanish curriculums, time is 3 hours, and it includes time for students to take 2 tests and 5 quizzes. And again, this is free. Okay, so the next one is Catch My Breath. Continuing with prevention, it's the only evidence-based youth nicotine vaping prevention program for grades 5 through 12. It's been proven to substantially reduce students' likelihood of vaping. The vape education program's effectiveness was published in a peer-reviewed journal, and the program is listed in SAMHSA's evidence-based resource guide series. So Catch My Breath peer-led teaching approach empowers students with the knowledge and skills needed to make informed decisions about e-cigarettes and resist social pressures to vape. And it's informed by tobacco youth prevention researchers and practitioners, years of real-world implementation, and a youth advisory board. It is the only school-based vaping prevention program proven to reduce the likelihood of vaping among youth. So recommended grades 5th through 12th grade, 4 lessons, 30 to 40 minutes each. It's free. This resource also does have available on their website a K through 4th grade toolkit, and that's for parents and caregivers. What also sticks out besides this being published in a peer-reviewed journal is that 7 out of 8 students say they are less likely to use e-cigarettes after Catch My Breath. Okay. So the FDA vaping prevention resources. So the FDA Center for Tobacco Products takes this issue seriously and created the Vaping Prevention and Education Resource Center to educate teachers, teens, and parents about the dangers of youth vaping. So this one's recommended for teachers, students, and parents. The teacher lesson plans, 50 minutes and it's for 6th through 12th grade. Cost is free. And for the students, what you'll find for students is videos, assignments, and learning activities. And for parents, you're going to get information on starting a conversation, online and community resources, and recognizing vaping products. Next one. All right, so prevention from Virginia Foundation for Healthy Youth. They have a nicotine products prevention modules. So in accordance with HB 1881, the Virginia Foundation for Healthy Youth developed the nicotine products prevention lessons to provide prevention education for K through 12 about products that contain nicotine like cigarettes, electronic cigarettes, and more. The lessons are correlated with Virginia's standards of learning and were created by Virginia public school teachers and Virginia Commonwealth University in conjunction with VFHY. So K through 12 is what this is recommended for. The times they can standalone lesson or can be combined with other tobacco use prevention. The presentation is 15 to 25 minutes long plus surveys. And some resources, they have implementation guide, prevention lessons, and they're also available in English and Spanish, and they have a pre and post survey. All right, so the next one is by the American Lung Association called Dept. So now we're moving on to alternative to suspension programs. So for teachers, the American Lung Association offers a free facilitator training course that is 1 hour long. And for students, the program is an alternative to suspension or citation program that is offered as an option to students who face suspension for violation of school tobacco use policies. So each of the 4 lessons addresses a different tobacco-related issue and can be facilitated either one-on-one or in a group setting. And the goal of each program is to educate students about nicotine dependence and cravings and guide them through the process of identifying their own reasons for chewing, smoking, or vaping tobacco products. This is for middle and high school. The time is 4 15-minute lesson sessions led by the facilitator, and this program is also free. All right, so the next one, another alternative to suspension. So this is called Healthy Futures. From Stanford Medicine. So first you have a self-paced online course called My Healthy Futures, which is an alternative to suspension program created by Stanford Reach Lab, developers the Tobacco Prevention Toolkit, and the Cannabis Awareness and Prevention Toolkit. And then you have Our Healthy Futures is a facilitator lab that can be offered in a 2-hour individual or group setting or a 4-hour group setting. So this is for middle and high school. So the Our Healthy Futures is facilitated group setting, 2-hour and 4-hour versions. And the My Healthy Futures is self-paced 40 to 60 minutes. So according to their website, the best course of action for using, if you're going to want to use this resource, would be to have the students first complete the My Healthy Futures on their own, followed by some teacher-student interaction using the Our Healthy Futures. Hopefully that kind of explained it a little better. And next one. Okay, so we have resources Empower Vape Free Youth Campaign. So the CDC launched this campaign in 2023 to encourage middle and high school educators to speak with students about the risks of e-cigarettes and nicotine addiction. The campaign also provides resources for educators to help students avoid or quit vaping. So they have videos on information on youth vaping, quitting, and encouraging healthy coping skills, videos on starting a dialogue with students about vaping, fact sheet and conversation card for educators. This is for middle and high school. It's prevention and cessation resources. And again, the cost is free. All right. Well, with that being said, I'm going to go ahead now and pass this on to Gina.
Thank you, Tiffany. Lots of resources, right? You're probably going through that and thinking, wow, which one is the right one for my school, my organization? And we thought as regional coordinators about that, was this too much information? But we really know that each school is different. Your time is different. Each youth organization is different. So we wanted to present the entire package and all the resources so that you can take a look at it and see which one best fits your situation. A lot of really good programs out there. And, we as regional coordinators can help assist in this in any way that we can. But we know that we really need to have other resources in place to help with cessation as well, right? Because we know that most teens who vape do want to quit. And next slide, please, Nicole. So over half of young e-cigarette users want to quit, and many have even tried. So when you have the schools and you have all the vaping in the schools, at home, during football games, wherever, we want to make sure that when someone comes up with them with the conversations such as Sarah had, and to tell people that, this is a tobacco-free school, please do not use tobacco or vape around here. We want to also make sure those conversations have a piece of cessation with it, right? We want to make sure they have the tools to successfully quit vaping. And we know that those motivators may include health reasons, financial reasons, social factors, but we want to make sure we are addressing cessation issues whenever we make any policy changes in the school or in a youth organization. Nicotine, I think this was one of the very first slides that Sarah put up. Nicotine is a true addiction, right? And they may not even see themselves as addicted, but they cannot stop using, and they want to stop using. And this is where we need to come in as public health and provide the resources for them. So about 2 years ago, you all know, or hopefully you all know, we have Quit Now Virginia, which does provide free cessation 24/7 on tobacco use for 13 years and older. But we wanted to have a very specific program to address the very high numbers of vaping that we are seeing and that you saw in the numbers in the earlier presentation. So we now have Live Vape Free Virginia, and it's a tool that you can use in your schools, in your organizations, to assist teens to quit smoking. And basically it's a two-part program. It's one for adults and one for youth. And next slide, please. We have the adult program to really start the conversation, right? The adult program is an online program at livevapefreevirginia.org that parents, teachers, administrators, coaches, nurses can sign up for and really get more information about what a vape looks like, how can I find it, how do I start the conversation, how do I really talk to my teen about quitting in a way that they will respond. And that's what we want to make sure, that we are opening up that conversation in a way that they respond to us and they know that we are the resources for them. So this is a program where any adult can go online and sign up for the program. It includes videos, activities, and an entire toolkit to kind of assist you with this process. Next slide, please. And here are a couple of just things that you may see on it. We have a conversation guide that really talks through different scenarios with you and your young person and how to kind of take some time, right? And prepare to stay calm. Even I love that slide. Prepare to stay calm and respectful of the young person, because I think as an adult, sometimes we feel like what we say they must listen to. And I think with vaping, it has to be a two-way conversation to where it is open and honest. They feel comfortable telling us that they are vaping, and we are open and respectful to that and provide them the resources. And they can sense a genuine engagement that we want to help them to quit using vapes. So that's what the adult program hopefully will share with our adults, our parents, our teachers, our administrators. But another part of this program is the teen program, and that's where teens can text Vape Free Virginia to 873-373 and get cessation help on how to quit. And it motivates teens to quit vaping. It helps them understand why they're vaping. It gives them some reasons to quit vaping: better academics, better athletic skills, a little bit more money in their pocket when they're not wasting their money on vapes. So this program is, again, a very important program to give them a coach, right? So during this program, they text that number, and it's an interactive texting with a coach. At any time, they text coach, and they can have that engagement with a coach. Again, using videos, podcasts, quizzes to really engage that teen. Again, we want your help in really promoting this program and getting it out there. They do follow up to see if that teen has quit using vapes. They do re-engagement if they have relapsed. So they really stick with the young person to make sure they have the engagement, that they have the resources to stay off vapes. We did a program last October, I believe, where we partnered with Darryl Green, who is a Hall of Famer cornerback, and he came to Deep Run High School in Henrico. We spent a day with him, with the entire high school at Deep Run. And I believe I can say this for our entire team: we had a most enjoyable day. Darryl presented on why not to use vapes, right? And instead of like us from the health department doing the presentation, really talking about why you shouldn't vape, the dangers of vaping, he came in and he engaged the young people. And they told him, yes, they were vaping, why they were vaping, what they needed to not vape. And it was just, again, an open and honest conversation with our young people around vaping. And we did this so we could get 4 PSAs to use, so that you can use them in any promotion of Live Vape Free Virginia. They are currently actually running throughout Virginia and will be to the end of the year on some of the major channels. So hopefully you have seen them, but you're more than welcome to use any of the videos anytime on your social media and in your classes or wherever you may want to, because we really enjoy doing this and we think it came out to be really great. And Nicole, I think, is getting ready to show the 60-second PSA.
I have it up, but it's not. Do you see any? I just see a black screen.
I do not see anything.
Okay, it worked in our practice session.
And if we cannot show it, that is fine. Maybe we can get it going as we continue on. But I encourage you, it is on livevapefreeva.org. So please go on there and look at the PSAs. They're marvelous tools, right, to really engage that youth. And this is a message right here that you can use when you display the video, or just a message you can use to promote Live Vape Free Virginia. You can see that it's long. You can use it however you want to. You can shorten it, but please do promote it and use it. And then just to kind of end this presentation, you're already doing so much in the communities, right? And we would love to partner with you in anything that you're doing out there. So please, as I just mentioned, share the Live Vape Free videos, share them on social media, reach out to schools, the independent schools or after school programs, and make sure they're aware of all of these resources, not just Live Vape Free Virginia, but all of the resources that we have shown through this entire presentation. Talk with your guidance counselors, talk with your school nurses, talk with your coaches, your athletic directors, and make sure they're aware of these materials. We are aware of them, right? Because we see them all the time. But sometimes when you go in the schools, they are not. They call us all the time wanting resources, wanting information about how to really react to the vaping that's going on in the schools. And again, I will go back to my earlier point. You are already doing so much in the communities, and we just wanted to kind of give a shout out to a few of you. And we know many more of you are doing things. Please put them in the chat if you are doing programs that are working out there. We have several that we wanted to highlight. Region 10 and UVA have come up with an entire toolkit for adults, right? That lists all the resources that they can hand out to schools and use in their area. Chesterfield Save Tobacco and Nicotine Task Force. They've done many presentations for schools, school nurses, and parents. They've helped write sections of parent and student handbooks. So this is community helping our community, right? It's all of us getting together, doing the presentations, figuring out which programs work, and writing different pieces. Also, EVMS, Eastern Virginia Medical School, has a very nice vaping education campaign, and I'm sure most of you have heard about Rethink Vape. That is a tremendous resource in the state around vaping. And of course, I've got to give a shout out to Pam. I'm not sure if she's on today, but Pam is like the Southwest expert for e-cigarettes and vapes, and she has done so many presentations in our area, not just in her New River Valley region, but throughout. She has an amazing vaping display. If you ever get a chance to see it, she has everything on that. So again, thank you, Pam, for kind of being out there to do this work, this very valuable work. If you have a program, again, put it in the chat. We would love to hear about it as we end this presentation. So I'm going to kind of wrap up because I know we want to have a couple minutes for questions. Nicole just put up this slide, and it's a resource. So you can clip any of this. You can have the QR codes to put on any of your media, any of your flyers, your posters, whatever you might want to use. Please definitely use it. We would like to really stress that as we tackle this issue, it's not just coming to a school and doing one presentation, right, on vaping once a year. It really has to be the culture and the system of that school to make sure everyone is aware this is a tobacco-free campus. You know, so the nurses and the athletic coaches have to really stress that to every patient that comes in or student that comes in the nurse's office, every student that's on a football team, baseball team. It has to be announcements through football games. The tobacco signage has to be put up. It has to be a constant reminder that this is a tobacco-free school, which means no vapes. So no vapes, no tobacco cigarettes, no smokeless tobacco, no anything. And that has to be the culture of the school. Easier said than done, I definitely recognize that, but it really has to be more than a one-time presentation. It has to be part of the culture, and we're here to help you. So I'm going to wrap that up because I always kind of tend to linger a little bit, but I'm going to wrap it up, turn it over to Nicole so that we can catch maybe a couple questions at the very end of the presentation.
Hi, thank you, Gina, for and everyone, Sarah and Tiffany, for compiling all the information to share with everyone and getting it together. So I usually go through the questions as we present, but since I was sharing my screen, I wasn't able to really screen them. But thank you for Sarah answering a question, and Tiffany as well. I think there was one person who talked about enforcement at football games. If someone else on the call, they talked about how do we really enforce, the tobacco-free policy at football games. And, if someone else has, a great way that they've been able to really do that, feel free to share. I know some at football games are supposed to make an announcement in the beginning. And I think the question is really about whether it's police officers or someone else, because when they try to talk to the person, they say it's nicotine-free vape. So I think it really goes to really educating who's enforcing it to really focus on, clean air for all, whether it's whatever product it is, whether it's, nicotine free, if they're lying and it does have nicotine, really just focus on people's health, whether it's their own or the people around them. And continue to share, what programs you're having. I see that some people have been sharing as well. Jenny shared her 3-year funding opportunity for youth tobacco use prevention programs, and there's a link on there as well. And continue to share those. Tiffany has shared our Tobacco Free Tuesday for next month as well. Thank you for that. And I we will be sharing the slides again in the follow-up email that Tiffany will be sending soon, and the recording as well. It'll be on YouTube. And Hannah from EVMS, the Rethink Vape team, has shared information. Oh, there are some survey links. If you're a parent or you work with teens, they have some surveys if you can help them with that. I'm creating a tool, the new iteration of this research grant. So, Sarah, do you have something to add in the last
Did you
few
see
minutes?
Jenny Martin's? I was looking at
did
some other questions.
slightly
Did you
talk to
mention
her.
that?
Yes, I did slightly.
Okay, great.
Opportunity. Yeah.
Yeah.
Oh, wait. I missed that part. Okay, so if you are looking to get funded, there is a new grant opportunity by VFHY. It's 3 years, and Jenny put the link to the RFP, the request for proposal details, in the chat, and Tiffany will include that in the email. It was in our last newsletter that was sent last week. If you're not in our newsletter, you can let one of us know or put your email in the chat. So you probably get the Tobacco Free Tuesdays email. So our monthly newsletter is a different email, different set of emails. But we share information, whether it's the VFHY funding, whether it's what's going on in the area, information about our team and what we're doing. So I don't see any more in the Q&A. So I'll pass it to Gina to wrap us up for today.
Thank you all for joining us for our September webinar. Lots of information, lots of work to be done, and we just really appreciate you in the communities coming alongside us to do this work. So please reach out. Please enjoy the rest of your September. Join us in October for our October webinar. Have a wonderful week. Bye.